Trust in politics is broken, so can we get UK politics working again?
That was the last time we were happy. 2012.
I'm Beth Rigby, Sky's political editor. Join me every week with Labour's Jess Phillips and Conservative peer Ruth Davidson for some electoral dysfunction.
This idea of nuance has completely left politics.
Yeah. Together, we'll focus on the policies that could deliver political satisfaction. Follow Electoral Dysfunction wherever you get your podcasts.
Simply put, it is the biggest treatment disaster to have hit the NHS since its inception. Thousands of people lost their lives having been infected with HIV and hepatitis C through contaminated blood products imported from the United States. Thousands more were infected by those who received the blood products or through infected blood being used for transfusion purposes. And yet, in the 50-plus years since those infected products arrived in the UK, precious little has been done by way of compensation, let alone the apportioning of blame. On Monday the 20th of May, that could well change. The Infected Blood Inquiry has, for 6 years now, sifted through millions of pages of evidence from hundreds of sources and will on Monday produce its conclusions. Too late, of course, for those who've already lost their lives. I'm Niall Paterson. Welcome to the Sky News Daily. Tom Clarke is our science and technology editor, and he's back on the podcast. This topic, it's been a story which has been around for as long as I can remember, really, and same for yourself, I imagine.
It's just a very, very long-running story of missed opportunities, failures, possibly even cover-up. That's something the inquiry is going to look into.
Take us back to the start. Again, memory fails me sometimes, but we are talking early 70s for the beginning of this story.
It really begins, I think, with a new treatment, a treatment for haemophilia. So this is an illness that affects predominantly boys, although there are various forms of the disease that can affect women, where your blood doesn't clot. And if you have it severely, minor injuries can cause death.
You can bleed to death, yeah.
So these medicines are essential. Before the medicines in question came along, kids used to have to go to hospital maybe twice a week for several hours to have infusions of other people's plasma, frozen and concentrated, for these factors that they lack. Then in the early 70s, very clever US drug makers came up with a way of concentrating those key proteins that haemophiliacs are missing into something that can be kept in the fridge and injected at home. So all of a sudden, haemophiliac children were able to basically live normal lives. However, these treatments were made by pooling large numbers of different people's blood donations, tens of thousands, we think, in some cases. So if any of those blood donors were carrying a virus, a bloodborne virus, it could end up in these medicines. And we now know that's exactly what was happening.
So there was no screening of the plasma that was taken from these people in the first place?
That's the case. In the early 1970s, we didn't have tests for a lot of viruses. If we did, they were things that had to go off to a lab and take weeks to do. But blood donation in America was a commercial enterprise, and companies bought from commercial providers of blood, and they took donations from poor communities because they paid people for a donation, $5 for a pint of blood. They also took it from prisons. Now, there's nothing wrong with that in and of itself, but in prison you're more likely to have people who are injecting drug users, you're more likely to have people sharing needles in prison because you don't have access to the things that you need, so it's a risky place to get blood from. There were experts in the US at the time who thought, hang on guys, if there's any contamination in these products, because we're pooling these samples together, that's going to go to everybody, and that is not safe. So it kind of got talked about, but nothing was done.
So why at that point didn't we start to develop our own?
That is something the inquiry has been picking over in detail. 1975, the WHO says countries should be self-sufficient for these sorts of products. We shouldn't be importing around the world. It could essentially spread any risk around. The UK looked into it. Memos were written. Committees were held. It didn't happen. Cost was one reason, but we don't really know why. There were contracts, advanced purchase contracts for these medicines from US drug companies. Was there a financial motivation? Again, the inquiry is looking into that, but they are really key questions. We know that David Owen, who was the health minister in 1975, was pushing for this self-sufficiency drive. We need, UK labs making this stuff. And we know that that wasn't taken up when he left office. And we also know all his papers from the time have mysteriously disappeared, and something he's been talking about for a long time. And that's one of the first clear failings. And what's so tragic, it was right there at the very, very beginning.
So, okay, let's just break this down and simplify this once again. Infected products coming from the United States being used in large quantities in this country.
That's right.
What were these products infected with?
They could have been infected with anything. What we now know was one of the key infectious agents was hepatitis C.
But explain what hepatitis C is.
Hepatitis C, it's a virus that affects the whole body. Anybody who's had it will talk about brain fog, fatigue, all sorts of extra health problems. But the organ it affects most dangerously is the liver, hence the hepatitis name. It can cause liver damage that can lead to liver failure and need for a transplant. It can also lead to liver cancer, the main cause of liver cancer still in the UK. And obviously later on, HIV made its way first to America, and then actually around the same time it was coming here of its own natural progression, it was coming here through infected blood products into the haemophiliac population. And they were some of the first people to be diagnosed with HIV in the UK. At the time, of course, it wasn't called HIV. They didn't know what it was. They were just dying of AIDS, and it was a mysterious illness. Even worse insult to the initial injury was, were these kids informed about risks? No, they or their parents. When they were infected, so many of them weren't told for years that they were carrying these viruses. And obviously that brings with it huge problems as well. But talking to some of the individuals, it's not just that. It's just how the whole thing played out. Hepatitis C, the risk was played down. When AIDS came along, they knew this was a deadly illness. Yeah. They had no way of treating. And some of these kids were told in quite impersonal ways, you are infected with HIV. There was no advice on what that meant for them. Some of them were told, you've got 2 years to live, age 14, 13, 12. And they then, a lot of them that we've spoken to have been at one school called Trelaws, which was apparently a great place. It helped a lot in the care of some of these kids with other disabilities, including haemophilia. This
was a school with an NHS kind of staff on site.
That's right, and it was there. And in a way, you talk to a lot of the people who lived and studied at that school. It was a great place. It was a good school. They got a great education. Because of the treatment available at school, they were able to do activities they never could have dreamt of doing at home. But it became a focal point of this disaster because so many of the boys there were infected with HIV, and they watched their classmates die over those early years of the AIDS crisis before there were treatments available. And the ones we're talking to now are the ones who, through luck of when they were born or the peculiarities of their immune systems, managed to hang on and not get sick until the first treatments for HIV came along in the early 1990s.
Tell me about Lee. I mean, one of those that you spoke to from the school. How does he view what has happened to him, to his school friends, many of whom are no longer with us?
He's very angry. The way he explained it to me was mostly with the people who have not had to answer for this for all the time that they've been suffering. The fact that his life has never really moved on from that. Although he got treatment for his HIV and is well compared to that, the hepatitis C that he has lived with for a long time, he didn't find out he had for decades after he was infected.
We didn't give, our consent. We didn't sign anything. There was just nothing. It was just done. I wasn't told till I was 14 years old. We had to sort of live in silence. We were told not to tell anyone, and to watch my friends die and knowing that I could be the next one, it was hard. They were playing Russian roulette with our lives.
But I think most pointedly, the thing that really upset me the most listening to his story, he carries guilt, a huge amount of guilt.
Survivor guilt.
Exactly. For why is he still alive when they are not? But it's something that this inquiry will never make right. Those wrongs can't be undone, unfortunately.
People have been losing their lives through the course of this inquiry, we should note. But in terms of the figures, I mean, do we know how many people roughly have been involved, have been tainted, have lost their lives?
It's certainly hundreds of haemophiliacs were infected and died from HIV and hepatitis C. It's more than 1,000 infected with hepatitis C and HIV who are still alive. But we haven't even talked about the parallel tragedy that's been going along since the 1970s here as well, and that's the safety of the UK blood supply. The focus has rightly been on this group of people who are so acutely affected because of these pooled, concentrated, risky products that were coming in from America. But at the same time, the NHS has to provide blood to anyone who needs it in the health service, and it's done that for a long time via blood donations. This is something that does not get talked about, and we uncovered looking through the inquiry documents. We were taking blood donations from prisoners in the UK right up until the late 1980s.
Really?
After HIV had even come here.
Really?
That was common practice. It dwindled down during the 1970s as risks started to emerge, but that was something that happened. We had a risky blood supply.
Yeah.
And the numbers bear that out. So we were just talking about the haemophiliacs numbering in 1,000 or two, 30,000 people, roughly. It's all estimated. We don't have hard numbers because a lot of the records have been lost. A lot of these people have subsequently died. But around 30,000 people were infected with hepatitis C through routine blood transfusions, surgery, cancer treatment, during childbirth, for example.
We must wait for the inquiry to come to its conclusions. They will do come Monday. But, you know, to the layman, there is blame to be apportioned round here, isn't there?
We shouldn't forget that in 1981, when the first case of AIDS emerged in America, they were stumped. They did not know what caused this. But I think it didn't take very long, in all honesty, for them to figure out it was a bloodborne infection. And when it started appearing in haemophiliacs who had no history of contact with anyone with HIV, it was really a big red flag.
Yeah.
Why did it take so that long for that risk to be flagged, to be highlighted, for change to actually happen? For public statements like there's no proof. Yes, it's true, there wasn't proof, but there was enough of a hypothesis. And I think what comes out with some of the testimony that I've read, some of the evidence I've read, a real prudishness around HIV. People just didn't want to talk publicly about what might be happening. Leaflets that would have been so important to give to blood donors. Please don't give blood if you might be at risk of this virus. They sat on those for months because there was a sense that they didn't want to put people off or upset regular blood donors who are very valuable by giving them something that talks about, gay sex, which was at the time some sort of, taboo subject. Those sorts of missed opportunities, I think, will loom large in the conclusions of the inquiry. But what the inquiry is having to consider is what happened next. Why, when we started much slower than we should have done, testing the UK blood supply, testing donors' blood for hepatitis C, and found that there was quite a lot of it in there. Why did it take so long? It took 4 years for the health service to do a look-back campaign. Let's try and trace the people who might have been infected. And then incredibly, when they had traced some of these people, they were offered testing, but were they offered treatment? It looks from that, not a lot of them were. A lot of them weren't advised properly. And those that might have been at risk. We've heard stories, some of the women I interviewed, knowing that they'd been given a transfusion around that time, going to their doctor saying, I think I might be at risk of hepatitis C, and not then being offered a test. Oh, if you're not a drug user, we're not going to test you for it. You probably haven't got it. This sort of ignorance, but also a lack of urgency to get on top of that. And the situation that emerged is we have people who were infected by a blood transfusion in the 1970s, early 1980s, not finding out about it for 2 decades maybe, by which time their liver has suffered the damage that it's going to get, and their risk of losing that liver or getting liver cancer is so much higher.
Thank you, Tom. We're going to pause there. So much already to digest. After the break, we'll be looking at whether this inquiry can provide all the answers so desperately sought, given the passage of time. Back soon. Welcome back. We continue our look ahead to the publication of the Infected Blood Inquiry's final report. Tom Clarke, our Science and Technology editor, is with me. OK, so we know that there are an awful lot of people who have been infected. We know that there are an awful lot of people who have lost their lives. Look, science develops over time. Innovation is obviously a big part of medical research, but sometimes we only latterly discover issues. I mean, is there any part of this where we can say, look, it wasn't the right decision, but we can recognise that it was the right decision only via hindsight?
I think for some of this, there might be. So hepatitis C, for example, I think it's fair to say, talking to doctors who were practicing at the time, they did not know back then what the long-term risk of that virus would be. They would now say, with the benefit of hindsight, that risk-benefit analysis was totally out of whack. They were possibly too persuaded that these wonderful new medicines that had changed the way they treat they were too good to give up.
Mm-hmm.
But I think in retrospect, it would have been very sensible to give them up. Other areas, and this is very, very contentious. So a lot of the boys at Trelawney School, we were talking about them earlier, they were recruited into clinical trials without their knowledge, without their consent.
How on earth is that possible?
You've got 100 kids, all of them have got haemophilia, and you've got a new treatment that's been heat treated that you think might be safer, but you think also it might not be as effective.
Mm-hmm.
And that is obviously going to be an issue. And you need to find out whether they work. But what it appears that happened, some of the kids who'd never had treatment before were given the more harmful one, the one that we now know was definitely infected with viruses. By today's modern that would just not be an acceptable design for a clinical trial.
Not.
And you wouldn't be able to, you would also not be able to recruit those patients without giving consent.
Mm.
However, in the 1970s and 1980s, what we now consider to be ethical consent, the rules around what is acceptable experimental medicine have changed a lot. That is not to, I'm not for a second trying to excuse what they did.
No, of course.
But it was the kind of thing that went on in hospitals up and down the country with new medicines and new treatments going on all the time. Inexcusable by today's standards. But at the time, understandable. And talking to some of these doctors say, how else could we have figured this out?
You did speak to one, Professor Tuddenham, who was at the Royal Free in the 80s.
Yes.
What is his take on his responsibility for this?
He's a controversial figure amongst many of the survivors of this and the families of victims because he has sought to defend some of the decisions that were made at the time. Why didn't you worry about hepatitis C so much? And were these experiments justified? And he's tried to explain the thinking at the time. However, as a doctor who thought he was doing best by his patients by giving them these medicines, he clearly expressed to me how devastating it was to watch those people he thought he was helping then die of illnesses like HIV.
Had we appreciated better the level of risk, we would have stopped using concentrates completely. By 1986, I left the haemophilia clinic to do full-time research, but of course I was in touch with my friends and patients who I knew. I was attending funerals regularly. To have caused this in the process of giving treatment is the worst thing you can imagine, looking back.
He also, I think we could say to his credit, at the hospital he worked, they decided to inform patients as soon as they tested positive for HIV, even though there was nothing they could offer them. But a lot of other doctors chose not to do that. People were left not knowing for some time. And that, again, with hindsight, is just an unforgivable thing to do to a child, a family, and anyone they might know. But another interesting thing about Ted Tuddenham, which came up in our interview, he left treating patients around the time this all kicked off, 1986, because he was working on isolating the gene for factor VIII. And he found it, him and a colleague, and now, because of that discovery, haemophiliacs are treated with recombinant therapies. They're not made from people's blood, they're made synthetically using bits of proteins, and that has spared haemophiliacs of the future facing any risk like this. So that was an interesting twist to this whole story.
Let's be generous and say that we have had a good idea of what has been going on for 20 years. This inquiry has been running for 6. Successive governments have run away from this. I'm including Labour and Conservative in this. And I have to admit, I cannot understand why. Beyond, do you know what? They're going to have to pay out an awful lot of money, and they didn't have very much of it.
I mean, there was some compensation paid. In 1990, a scheme was announced. However, it was limited. It came also with a caveat. If you take it, you can't prosecute the government in future.
Yeah,
what appears to be really unpleasant is people were told, if you don't sign it, nobody will get compensation. So that was understandably deeply unsatisfactory to the victims. And you have to ask, why have we just failed on this for so long? Exactly. And we know this from previous compensation schemes like those for minors, for example. There was clearly an effort to, if we drag this out for long enough, most of those people will have died and the cost to the taxpayer will be reduced. What's going to be a challenge, it'll be very interesting to see where the inquiry gets to on this. There's a lot of the evidence they've seen, they haven't published and put up on the website publicly, so we haven't been able to scrutinise it yet. Is there a smoking gun? Is there evidence that there were deliberate efforts to obfuscate, delay? Minister said, I was advised X, Y and Z. Did the ministers really not know and not act? Was this something that was happening within the civil service in the relevant departments during that time? Let's just not tell the minister. There certainly does seem to be evidence from what some of the campaigns established that large amounts of documents that are rather key to answering some of these questions seem to have been destroyed at various times. And also in a way that doesn't quite line up with normal document retirement sort of protocols. So there is certainly, there's a suspicion of that. I mean, David Owen has been, Lord Owen, now former health minister, when he asked for his ministerial papers from around that time, because he was pushing for this self-sufficiency for blood, was told they'd been destroyed under a 10-year rule. And as Andy Burnham, he's another modern-day MP who's campaigning on this, points out that he's never heard of a 10-year rule. And he was a minister under the last government because there isn't one. So there are some very big questions for politicians to answer. But I think what fascinates me is, why do we keep ending up in this situation with inquiries happening often decades after the wrong was committed, and then multiplied by years of inaction? I wonder if it's something about the fact when you get large groups of people and committees and departments, they make the amoral decisions. Organisations aren't able to act in the interests of one or two people, it seems. I just baffled. It boggles the mind to look at all the opportunities that were missed, yet here we are, long after most of these people have died, finally, hopefully finally, getting some answers as to who messed up and how badly.
It baffles, boggles and beggars belief, frankly. Tom, we will await the inquiry's findings with huge interest for now. Thanks very much indeed.
Thank you.
The report this Monday is certainly not the end of the process. Compensation will have to be paid, and it's not beyond the realm of possibility that there could be some legal culpability that emerges from the inquiry's conclusions. But we are decades on now from identifying both the infected blood and that there would be a need for a forensic look at the decisions that led to so many deaths. The inquiry itself has taken 6 years to reach its conclusion. So much time has passed, too much, for those whose time has already run out. That's your lot for this edition of The Daily. We'll see you soon.